I'm here at the Assuta hospital, which is the dream of every surgeon because they have thousands and hundreds of thousands of treatment done. And I'm talking to Tal here, who started the home care part in a hospital which is obsessed with operations. And Tal, how was that to start this home care division last year in this hospital, which is not made for that in terms of medicine, in terms of thinking?
First of all, it was difficult in one way, and it was thrilling on the other part of and we go step by step, like a baby.
Yeah.
And the paradigm, like a shifting of the paradigm. Surgeons come to do surgeries at the hospital, and then I'm talking about home care, about treating the patient at their home.
Yeah.
And challenging.
Let's talk about that journey in a second. First, I mean, what is your background?
So I'm a GP and a sports doctor, and I'm now the medical director of Assuta at Home Services.
Yeah. So that's a small project, and it's growing, and you have to explain to the doctors that there is before, during, and afterwards. Can you describe how the program works at the moment?
Yeah, so we have the main service that we give is 3 parts. First of all, we have service after orthopedic surgery, rehabilitation rehabilitation program after the surgeries. The second part is after heart surgery, recovery after heart surgery. And the third part is the home hospitalization and doctor diagnosis, in which we use home x-ray, lab test, special, like doctors and nurses visit the patient at home, physiotherapist, dietitian. It depends on the case.
Okay, so let's take the after patient care after an operation. You use a certain platform for that. What's the name?
Yeah. So the home recovery service after heart surgery.
Yeah. What is the name of the platform, the technical platform?
The technical, it's the Datos.
Yeah.
The Datos,
Yeah.
and we use also a cardiac machine which transmits the heart signal to a special place in which there is a cardiologist sitting and interpret the ECG.
Yeah. So you basically, after the patient is at home, he gets monitored. He has an app, and he gets questions, and his vital signs are also measured and given to the doctor. So the patient has the idea. It's asynchronous. It's not that he has like a call, but it's asynchronous, and the doctor looks at it, and the exceptions basically he has to treat, right?
Yeah, and we can send him messages, and he can contact us. And there's also a possibility to do virtual visits, which is nice.
Which is synchronized, so at the same time, or?
Yeah.
Okay. And so how many of those have you done so far? How many patients? Because it's not for everybody. It's a private service at the moment. I mean, so 40% of the Israeli have a private insurance on top of the public one. And so how many of those have you done so far?
Around 20 patients, all from Assuta. Assuta is one of the biggest places in Israel which operate open heart surgery. Yeah, we have good experience. We start like this is the beginning, but still we have experience.
Yeah. What is so at 20 and you just started, so it's too early to have numbers. But what is your impressions? Why is it useful?
First of all, after the heart surgery, the patient go home and they are alone, and they are anxious, they are afraid, they have pain. So it gives them like a safety zone. They can contact us, and they feel secure. Security is the leading word. Security, and in addition, the house is the best place to recover. And if we bring the medicine to the patient house, we can prevent the readmission. Frail old patient can have infection at the hospital, deconditioning of the muscles, they become weak, recurrent falls. So it prevents them. They are in their safe home environment and they feel safe and secure.
And that is, of course, what we think that might happen. Do you also feel in practice this is happening?
For sure.
Yeah.
For sure. This is a private service, okay?
Yeah.
So they get the surrounding are like we surround them with care
and attention,
and they write us feedbacks. From I think it's a natural place, and we talk to them and we also keep in touch with them after they are released. If they need something here in Assuta, we have close connection to the chest, the thoracic chest department.
But of course, one contact and one monitor is automatic. You know, the vital signs come in, and people say, "I'm feeling great" or "I'm feeling bad." Does it lead to more hours work for the professionals or less? Because all the ones who have no problem, you don't need to monitor, you don't need to talk to. How is it in terms of hours?
Usually, most of the patients are okay. Okay, and they have a daily phone calls. I think that less hours of follow up, and because they know that they have the possibility to contact us.
So those kinds of numbers we're all, of course, very waiting for, because that influences the business case, and that means you can do it to all the patients, also in the public one, because at the moment the public side doesn't reimburse it yet. What is the price for this after operation monitoring?
So it's around, it's exactly 7,000 shekels, which it's like $2,000 approximately. And they get refunds from the private insurance companies.
100% or 50%?
No, 50.
They have to pay $1,000 for that service, and then they're guaranteed to have attention, and they think it's worth it so far?
I think the feedbacks are good till now.
Do you think it should be for everybody?
I'm sure that, because as I told you, the people of Israel which go to the hospital and do the surgery, they are released home. And they are alone. And
I think, it looks to me everybody should do it. Okay, you have 100,000 operations in this hospital, 100,000 a year. So huge numbers. Every day you have 300 operations. You now have 20. How, based on your current experience, how fast are you going to scale up this service?
Wow.
Where are the bottlenecks?
First of all, it's step by step. There are a lot of obstacles, because when you change the paradigm, the thought, it takes time. We have time. We are learning each day. We are learning and consulting. It's a good question. You know, most of the good questions don't have answers.
Thank you. Okay. Then if you look at the attitude of the physicians, they go like, why the patients need to come to me? And how is that going? I mean, how many people are involved in your project, and what is the reaction on the physicians? Okay,
so we have special units. We are 6 in this unit, which is composed of the head nurse and the finance consultant and the secretary, and we have around 9 doctors, and nurses, around 15, I think.
Who are involved in this project.
And physiotherapists also.
So it's like 25 people for 20 patients. So it's very at the moment, very time intensive.
No, but we have other services. We have the orthopedic rehabilitation, and we have the home care, home diagnosis.
So how many patients are totally into this program?
It depends on the
50, 100.
No, less. I think around 20, 25, because we have also lab tests at home and x-rays and ultrasounds. Maybe 30, 25, it depends.
So it's really totally at the beginning, you're a baby, you're, where will you be next year from now if we come back?
First of all, we will work with other health institutes, HMOs, with more services, palliative care and wellness. This is the main issue, the wellness, the mind and the body. The earth needs it.
And you give people rest, you give them peace, you give them happiness and that kind of stuff. So that is something. Hospice. But I mean, here you can grow inside only this this hospital. You can grow to 100,000 people a year. But will that take 10 years, or will it only? What's your vision? Will this take 10 years and everybody will be covered, or will this be for a very small percentage of the patients?
I tell you what. Until the 1980s, less than 1% of the doctor-patient visits were at home. Okay? And at the past decade, the governments understand that the people want to get their treatment at home. And we see an increased number in home visits. So I'm sure that it's a national issue. The pandemic, countries in which the clinic is hundreds or even thousands of kilometers, and technology which raise in a...
You're positive about it. Okay.
It depends on the glasses that you wear.
Okay. Thank you very much.
Thank you.